Good morning, everyone. It is Monday, October 25th. Welcome into the Morning Medical Update. We are live here inside the Dolph Simons Family Broadcast Studio. Thank you for joining us on YouTube and Facebook on this Monday. Today, we begin the last week of October, Breast Cancer Awareness Month. We are joined by a young woman studying to become a doctor, but found herself part of the breast cancer research that she was doing when she was diagnosed with breast cancer. We're going to hear more on her story, and we're going to talk with her live here on the program, along with Dr. Ann O'Day, one of our medical oncologists from our cancer center. So make sure to get in your questions, get those sent in to us via YouTube, Facebook, Twitter, and you can also go to the Medical News Network, and you can find links to those right here on your screen. So start thinking of some questions, get those in. We're going to turn now to Medical Director of Infection and Prevention, Dr. Dana Hawkinson, joining us on this Monday. How are you? How was your weekend?
I'm good. It was good. Relaxing.
Good.
How was yours?
It was pretty good. We've got some fun news to share.
Hopefully we'll hear about it.
We will. So stick with us till the end of the show because we want to share some fun news with our viewers. But tell us how we did over the weekend regarding our numbers.
Yeah, we're still holding steady in that high teens to low 20s. We have 22 active infections right now, 10 in the ICU, though, so a high proportion of our total active infections in the ICU, with 5 on the ventilator. 3 of those 22 patients are fully vaccinated. We still have 23 additional people meeting that recovery criteria, so overall, a total of 45 patients in the hospital.
All right, thanks so much. We're going to get to reporter questions. Do we have any on the line today? None on the line? Okay, I do have a couple actually sent in from Donna. Good morning, Donna, over at Channel 9. A group of Jackson County legislators want to end the county's mask mandate early, citing falling COVID-19 case numbers and a testing positivity rate now below 10. So lower cases as we're seeing. The mandate is set to run through November 7th. Would it be wise to pull the mandate early or safer to just stay on course the way it's been? What are your thoughts?
Yeah. I mean, again, I think we shouldn't get too granular here and just have to understand the broad or overreaching information that we've garnered from really the vast majority of the data. And that data would support the fact that we know that in those high-risk situations, certainly indoors, masks are useful. Social distancing is useful. And so we have to believe, and we have said this before, mitigating the spread of COVID-19 is not just one thing. It's just not having everybody vaccinated. It's not just masks. It's a combination of all those things. So we certainly have to understand and have to believe, based on what we have been through so far, that when those steps and those pieces are taken away, whether it's going more indoors and doing things, meeting more in those small confined spaces, reducing mask usage, we have to expect that overall the cases will go up. Certainly we would expect that. That would has been played out before. We have to expect that again. And so I think from the public health and the medical standpoint, we have to understand that when those mitigation strategies are reduced or taken away, you would have to expect that there would be an increase in cases. Hopefully not. We still want everybody to get vaccinated. That would be the best method of prevention for you as an individual, a family, and of course our community. But we just have to understand and know that when those things are taken out, those non-pharmaceutical intervention strategies, that you would have to expect that cases would start to increase again. So
she's also asking that KCMO's mask mandate runs through the 4th, Wyandottes through the 18th. Do these dates make sense given the current infection rates being lower or steady, or should they be extended really to help cover the holiday season?
Yeah, again, from the medical standpoint, the public health standpoint, I think many of my colleagues would certainly advocate for the use of the continued use of masking and doing those things to help prevent those new infections, the spread of disease. But we do understand also that there are other priorities, other aspects of running a government, running a city, a community that have to be taken into account. But I think we would all certainly advocate for continuing as much as possible those non-pharmaceutical interventions, masking, restrictions, to help reduce overall the number of people in certain areas. Certainly continuing to promote businesses having outdoor spaces in the open where people can be doing things, certainly as much as the weather allows as well.
Any other reporters on the line? Okay, so we are going to get to your community questions here in just a few moments. But first, we want to introduce you to a young, vibrant med student who, during research that she was conducting on breast cancer as part of her studies, found out that she had triple negative breast cancer herself. Here's Petrania Punsuan with her story.
I honestly never thought in a million years that I would ever become a cancer patient. Nevertheless, a breast cancer patient, seeing as it's what I study.
Lauren Werner was diagnosed with triple-negative breast cancer in the spring of 2020. This as she was studying breast cancer as part of her PhD research at the University of Kansas School of Medicine.
I discovered it doing a routine breast exam. Just felt like maybe a grape-sized lump, a little smaller than that. It was hard. I was immediately thinking in my mind, oh, yikes, like lumps in your breast should not be hard. So immediately my radar went off and I went to go get it checked out.
Werner, 29 at the time, enrolled in a clinical trial at the University of Kansas Cancer Center, where she was learning and working to improve cancer treatments for others.
I'm so grateful that I did, because I had honestly the best outcome that I could have asked for. I ended up having a complete response to the clinical trial, which was chemotherapy combined with immunotherapy, followed by surgery.
Lauren had a bilateral mastectomy and breast reconstruction surgery at the Cancer Center. It's also where doctors discovered she carries the hereditary BRCA breast cancer gene.
After we found out that I was a carrier of the mutation that allowed the rest of my family to get screened, my sister actually just got a preventative double mastectomy, so we were able to prevent this from ever happening to her.
Lauren is now taking part in a high-risk gynecology program for ovarian cancer prevention.
I think in the end, an extremely valuable experience to have gone through as a future physician, because I think I can see through a patient's lens better than most providers ever could at this point.
During Breast Cancer Awareness Month last year, in the middle of a pandemic, Lauren raised almost $25,000 during an online fundraiser to advance breast cancer research. After getting her PhD at KUMC, Lauren plans to apply for a residency position in internal medicine, followed by a fellowship in medical oncology. Back to you.
And we are joined now by medical oncologist at the University of Kansas Cancer Center, Dr. Ann O'Day, and also Lauren Werner. She is here with us this morning. So glad to have both of you. How are you?
Great. Thank you so much.
Good.
So good to hear and see those beautiful pictures of Lauren.
Oh, you and I were both beaming and smiling as we were watching that. I looked at you. I said, those pictures of her just ear to ear smiling and just seeing the bright side of everything. Lauren, I do want to start with you first. How are you doing now? Where are you with your treatments and follow-ups?
I am doing really well now. I had my double mastectomy last November and found out shortly after that I had a complete response to treatment. So since then, I have just been doing follow-ups every 3 months. I have my next one next week. So I'm doing really well.
We love to hear that. So I can't help but notice you're young, you've got big things ahead of you. Then you hear you have cancer. Just tell us and kind of walk us through what that moment was like for you.
I think it's really hard to describe in words, but probably the easiest thing to describe it would be earth-shattering. Like, nobody expects to hear you have cancer when you're 29. You expect to maybe hear that about your parent or a grandparent, but never yourself.
So you go through cancer during a pandemic. I have to ask you, what was that like, that added layer?
I think the hardest part of that was going to appointments alone. At the time, we were allowed to bring one visitor to our appointments with our physicians, but I had to go to every chemotherapy infusion alone. And it's not an easy thing to do alone. It's very scary, especially the first time. So I think knowing that patients had to do that during COVID was very sad, both for myself and thinking about other patients going through cancer at the time that were dealing with some bigger procedures.
Lauren, you're not the first person to say that. I think when I asked that question, Dr. O'Day, that's the first thing when I say, how did this pandemic affect you? It really wasn't about COVID. It was about what that did as far as hindering their support during this really, really rough time. Jump in and tell us a little bit about Lauren's story from a medical perspective.
Sure. What we know about Lauren's case is that she's representative of a group of women diagnosed with triple-negative breast cancer. This is a subtype of breast cancer that often affects younger women. They're very often in the prime of their life, in their 20s or 30s, just as Lauren was studying for her MD and PhD. And she was very much preparing for a life to help many people in the future, as now I know she will do. Just a little bit of an interruption for some treatment, and she went through it with tremendous grace, and it was just an honor to get to know her.
So you touched on it, but how common is it for a woman to be diagnosed in their 20s and 30s? I think Lauren touched on it. It's something you maybe your older aunt or your grandmother, or unfortunately maybe a parent going through it, but you just don't hear about it. Is it more common?
So we know that certain subtypes of breast cancer have a predilection to affect women at a younger age. Certainly Lauren's subtype of breast cancer, what we call the triple negative subtype, which is that is not driven by hormones or the HER2 growth factor. So that's what we call triple negative breast cancer, certainly is more likely to affect younger women, often in their 20s and 30s. And in Lauren's case, she, as she alluded to in the video, she was found to have a pathogenic mutation in BRCA gene. And we know for patients that harbor those mutations that they inherit, that they can often be diagnosed as early as their 20s. And so the message for everyone is to, as Lauren did, listen to your body. If you know something isn't right, make sure that you seek care, advocate for yourself, and make sure that that is, fully checked out. Because certainly I have many patients in their 20s.
Well, but people aren't getting regular mammograms in their 20s or 30s, right?
Correct, definitely not. And so women, in Lauren's case, she had no idea that she harbored this hereditary predisposition. So women in this age group haven't even begun to think about getting screening mammography yet, unless they have the good fortune. Like in Lauren's case, she was able to inform her sister, and now her sister was able to take preventative care decisions so that she won't ever have to go through this. And so that's really the message, is that information is power. The more we can help these families and these individual women, the more we can do to prevent this from happening.
Because so many women wish they would have known, or wish they would have known that they could pass that information along so that they could get that high-risk care.
Absolutely. I can't think of a better gift for a sister to give another sister. It's just another example of how brave Lauren is.
The gift. I love you saying that. That's so true. Lauren, how did you find out that you had breast cancer? Was it through self-exams? If you weren't getting your mammograms, how did you discover this?
I did discover it doing a self-exam, and I'm very lucky that I did, because we caught it at an early stage.
And that's so important. We
So
talk
important.
about that.
So important. And I can't emphasize enough that young women are often sort of told, even if they seek care, with their primary care doctor or their gynecologist, they're often told, oh, you're so young, we'll just keep an eye on it, we'll check it again in a few months. And I think really the message is, if you feel like something is not right, you feel like something is off with your body, absolutely push to, have some imaging done, be examined by a specialist. There's no harm in that. And so just making sure to really advocate for yourself.
A dear friend of mine called me on Friday evening and said, I found a lump. I felt a lump. And she said, I was up all night online on the Susan G. Komen site, doing what I think a lot of women do. When you think there's something wrong with you or somebody in your family, you go sitting up at night scrolling through trying to diagnose yourself until you can get to that mammogram. She goes, I will tell you, I have a mammogram set for 7:30 tomorrow morning. And but I called her afterwards, and she said, I just feel so grateful that I did it. So
absolutely.
So that's it. I think it's just being empowered and knowing to get in there and get those tests done.
And I think the message is not one of fear. I think so many women, when they feel something, I know personally I lost my own grandmother because she was afraid when she felt something, and afraid that there wouldn't be anything that they could do, and maybe the treatment would be so awful that it's not something you really want to go through.
Right.
But the message is really, we absolutely can do things to help. Almost all breast cancer is curable if it's caught early, and so just the message is one of optimism, not
fear. Be glad you found the lump.
Absolutely.
There's a very, very good chance you found it early enough.
Absolutely.
So, right. Don't be afraid. Okay. So I want to ask you, Lauren, what went into your decision to get that double mastectomy? Your sister went ahead and did it too.
She did. For me, the decision was very easy. I had an aggressive form of breast cancer, and I knew that I harbored the BRCA1 mutation, which meant that for me, even if I got a single mastectomy, my chance of getting cancer in my other breast was about 80%. So that was not something that I was willing to mess around with. Breasts are just breasts. There's really great reconstruction options today. So for me, it was not a hard decision at all. After finding out that my sister carried the mutation, it was a hard decision for her because she wasn't facing cancer at the time. She was faced with the decision to amputate some of her body parts just to prevent cancer. And she's only 25 years old, in the prime of her life, never thinking that this would be something that she has to deal with. But ultimately, after seeing what I had to go through, she decided it was not worth the risk. And she's very happy with the outcome for herself as well.
Well, I'm glad she's doing well. Dr. O'Day, taking off your breast, it's a really aggressive route to take, and we know though that women do that. Tell me a little bit about that. What kind of risk would her sister have had, and then tell us some other options if you didn't want to do that.
Yeah, absolutely. So although it was definitely the right decision for Lauren, and ultimately was the right decision for her sister as well, when we talk about women that are healthy, meaning that they have not been diagnosed with breast cancer or ovarian cancer for that matter, these are decisions that are very preventative. So as Lauren articulated, you're talking about removing a part of your body that's otherwise healthy, as far as you know is healthy. And so for lots of women, it is something that they're not ready or willing to do. Lots of women want to wait until they're done with childbearing. They want to wait until a different time in their life, maybe till they've finished. I have a patient that just moved forward after she finished law school. Everybody has a time in their life that might be right for them. The message is not that every woman that harbors one of these genetic mutations has to move forward with this preventative surgery, although that's certainly an option. There are lots of other preventative strategies we can take. We have medications which are FDA approved for the prevention of breast cancer. Very few people know that. We also have lots of amazing screening options. So patients who harbor one of these genetic mutations now will qualify for better screening. So we can often, through breast MRI, through automated breast ultrasound and mammography, we can detect cancers that are microscopic. We're even detecting what we call pre-cancers. And so that is certainly an option for some women as well that harbor these mutations.
And BCRA, that also higher your risk for ovarian cancer, correct?
Right. The BRCA mutation increases the risk for breast, ovarian cancer, and other types of cancer, melanoma cancer, prostate cancer, some types of pancreas cancer. So it's so important that we identify these hereditary mutations so we can design a comprehensive multidisciplinary plan of screening and surveillance for those women.
And I don't want to, you said it. I don't want to skip over the men because I do like to mention this and please remind our viewers that what should men know if somebody in their family has tested positive for this mutation? How could that affect them? And then what should they do?
They should absolutely seek genetic counseling and testing. We know that these cancers can affect the prostate. They can cause melanoma. We see male breast cancer. I have a patient I'm treating right now for bilateral male breast cancer. These are things that absolutely can affect men. And we also want to make sure that everyone understands these hereditary genes can be passed through the paternal or the male side of the family. I often hear from women who are diagnosed at a young age, well, I wasn't worried about the breast cancer in my family because this was all on my dad's side of the family. So not something I thought I had to worry about. But these genes absolutely can be passed through the paternal side as well. In fact, I take care of many young women who we know this came through the paternal side of the family, and we have generations where there's no breast cancer because maybe dad had all brothers and their grandfather maybe had all brothers. And then all of a sudden we get a 24-year-old with breast cancer. So absolutely important for men to be aware of this as well.
Okay, so Lauren, I know you entered into Dr. Sharma's trial. You also decided that you wanted to do fertility preservation. Tell us a little bit about what went into that decision and just what it entailed.
So for fertility preservation, that was extremely important for me. I know that I want to have a family at some point, and anytime that you're going to be getting chemotherapy, there is a chance that all of your eggs can be gone afterwards. So I went through fertility preservation before starting chemo to try and improve my chances of having my own family someday. Regarding entering the trial, that was a trickier decision for me since the trial is not currently the standard of care. It's a new therapy regimen that's being evaluated to see if it will work. So anytime that women are making the decision to enter these trials, including myself, it's a scary decision. It's not an easy decision to make. But for myself, the trial included chemotherapy as well as immunotherapy. And it was a specific type of immunotherapy that I actually know a lot about because I'm pursuing my PhD thesis work in a breast cancer lab and previously worked in another cancer research laboratory studying these drugs. So I read the literature that was out there about these therapies and made the decision that it looked like these therapies were promising enough that I wanted to pursue entering the trial. And I'm extremely glad that I did.
Well, and Lauren, it just sounds like you kind of became your own patient. And I can't help but think that that is going to have such a positive impact, right, Doctor, about just the way she's going to be able to care for her patients one day. Such a unique perspective, just being part of the trial, doing the fertility preservation, being part of the high risk program. Tell us a little bit more about that as you envision yourself down the road caring for patients and those conversations that you'll be able to have with them firsthand.
Yeah, I obviously would never want to go through this again or never ask to go through cancer, but I think that is the biggest silver lining for me is I want to treat breast cancer patients in the future. I want to have a breast cancer research lab, and now I have actually experienced firsthand what these patients go through. And I'll be honest, like going through cancer treatment is nothing what I expected it to be like. The things that are hard were not the things that I expected would be hard. The things that were easy, I didn't expect to be easy. So I'm extremely grateful that when I go into the clinic someday, when I'm done with all my training, I'll have a unique perspective when I'm speaking to my future patients about different aspects of treatment.
What did surprise you the most going through this experience?
Honestly, I think I was surprised mostly by how easy the physical symptoms would be to handle compared to like the mental struggles that go along with cancer. Kind of just knowing that there is a pretty good chance that you could end up dying from the disease is just a really hard thing to wrap your mind around, especially at such a young age. So I think that was the biggest struggle for me at the time. Like going through the treatment was not, I'm not going to say it was easy, but it was easier for me to do, knowing I just need to do these steps and hopefully I'll have a good outcome. But the mental side is something that I wasn't prepared for, and I think is also potentially not taken into account as much sometimes for patients when they're going through treatment. So I think that'll be something that I'm always looking out for as a future provider, setting patients up with mental health services when they're going through cancer treatment.
Yeah, I bet. It's not something that you hear from your patients a lot too.
Absolutely. In fact, we have a comprehensive team of oncology psychologists at our cancer center, and my only wish is that we had more of those individuals. We wish every single patient could have that support going through treatment, especially during the pandemic. As Lauren mentioned, to send a patient upstairs for their first cycle of chemotherapy alone was heartbreaking, and we hated that for our patients. It's what we had to do to keep people safe. It was the right decision, but it was heartbreaking. And telling someone they had cancer, telling someone they needed to remove their breast tissue, telling someone that they had to go through 6 months of chemotherapy for the first time when they're sitting alone in a room, when maybe their husband is on FaceTime trying to be supportive through a phone call. It was really unimaginable, and it added a whole nother layer of the psychological challenges Lauren so beautifully articulated. Of course, she handled it with tremendous grace, and I have no doubt that she's going to be the most amazing, empathetic cancer doctor in the future.
Well, it's hard for the patient, but Dr. O'Day, I would imagine it was an emotional time for you too. Something you had not experienced before, having to say those things and being the only person in the room with them. It's definitely a different dynamic.
Yeah, it was a new challenge, but of course, we're always just thinking about our patients and their challenges, and just so in awe of them. I'm humbled every day to get to be able to work with my patients, and they're all inspiring.
You get through it together. Okay,
Yes.
So you'd mentioned multidisciplinary care. We hear that big word. Mm-hmm. What does that really mean here at our place, and how does it ultimately impact patients? We see Lauren was such a great example of that, but tell us more about what that means to patient care.
Mm-hmm. And I want to thank Lauren for being brave enough to share her story, because her situation to me is just the absolute epitome of a situation where a person, again, in the prime of their life with multiple nuances, such as the BRCA mutation, being diagnosed at a young age, being diagnosed with a rare subtype of breast cancer. These are patients that absolutely will have better outcomes, better survival if they receive multidisciplinary care at a specialized center where each individual that they see, from the pathologist to the oncologist to the reconstructive surgeon to the radiation oncologist to the breast surgeon, everyone has specialized and dedicated their lives to that type of cancer. In our case, to breast cancer. In Lauren's situation, it is so tangibly apparent because the treatment that she received, thank goodness, thanks to my brilliant partner, Dr. Sharma, the care that we were able to provide her on a research protocol in 2020 is now approved as of 3 weeks ago. It is now the standard of care. And we know that it improves survival by close to 10%. And so without that clinical trial opportunity, Lauryn would have missed out on, just because of the year that she was diagnosed, that treatment wasn't available outside of a clinical trial. So coming to a center where these types of treatment options are available, it gives us the opportunity to provide better than the standard of care before it's available to the masses. And every single young woman, we think deserves that. Every woman deserves that, but particularly our young patients. There are many nuances to this care, and they deserve to have every possible opportunity, even before it's approved by the FDA. So next week at your appointment, Lauren, I was going to tell you that and celebrate that with you, that about 3 weeks ago, the immunotherapy that you received now has full approval by the FDA.
Well, we're going to celebrate it right now. That's fantastic. How do you feel about that, Lauren? Just to know that you are a part of that.
I mean, it's extremely emotional to hear that. I'll be honest. I'm just really excited that it's a therapy that ended up being successful, and that in the future, that women will be able to benefit from this therapy without having to be scared of entering a trial. It's now the standard of care. So that is going to be what doctors are telling their patients is the latest and greatest, but it's approved. So yeah, that's extremely exciting for me to hear.
I love it when we talk about trials, because it does kind of demystifies what they're about, and then we get to see people who have been through them, and we get to hear their stories. Right. It makes a big impact.
Yeah, there's no greater gift that really a patient can give to other women moving forward. You think about everything that we do today in breast cancer, whether it's the type of reconstruction, the certain types of surgery, the immunotherapy, the combination of drugs, the supportive care, all of those things that we're able to do today, we are able to do because of brave women like Lauryn. And I'm just amazed that maybe someday you might prescribe this treatment for a patient and know that you very much were a part of making that possible.
Okay, we are going to get to some community questions. We know you've got a few of those good ones coming in today. And Dr. Hawkinson, I'm going to let you jump in. Angela says, Dr. Hawkinson, can the vaccine stop palpitations? Right after my third vaccine, I haven't had one palpitation.
Yeah, and I think we got questions about this regarding, can it cause palpitations weeks after the vaccination? So I don't know that there's really an association or a relationship between either of those. I don't see a mechanism for the vaccine, getting the vaccine and then having your palpitations stop because of that. So I would certainly, if you continue to have cardiac issues, I would certainly seek the opinion of a cardiologist.
Good advice. But that was a new one. We hadn't heard that one before.
Yeah, I'm glad to hear that at least it causes maybe some good effect of stopping, palpitations. But again, I'm not really sure that there's an association with that.
Yeah, but getting to the cardiologist, good advice. Yeah. Phyllis says, I had my last vaccine in March. I had COVID in September and also got the antibody shot. When should I get my flu vaccine?
You can get your flu vaccine at any point in time. Now we're hitting that end of October, early November period. It's probably a good time to go and get it now. That flu vaccine-induced immunity will last you through really what we traditionally have as our influenza season. So anytime that you want to go get it, go ahead and get it.
Okay, Elaine wants to know, do children ever get breast cancer. What is the youngest age you've ever heard of someone getting breast cancer?
Sure, and that's a great question because we often have patients that are known hereditary predisposition, like the BRCA mutation, and they wonder what's the right age to get their children tested. The youngest patient that I've ever treated is 23. That's extremely young. What we always want to talk about is looking at the family history and thinking about 10 years younger than the youngest person in the family was diagnosed. That's when we really want to make sure that this is on our radar. So, for example, if you have, your Aunt Sue is diagnosed with breast cancer, maybe in her early 40s, we want to make sure that the people in the family are getting screened 10 years younger than that, so in the early 30s. And if there's an opportunity for genetic testing, we would want to make sure that it happens by that date so that we could be pursuing the best preventative care.
What have you been seeing with your patients as far as late diagnosis with your practice with your patients due to the pandemic? We always ask if we've got caught up yet, but that must have been a huge concern early on.
It absolutely was. I think in breast cancer, we certainly saw sort of a lack of the average patient with breast cancer, the average 65-year-old. Many of those women delayed their mammograms, and rightly so, for a few months just to try to avoid exposures and adhere with social distancing guidelines. I think we're finally getting caught up on those people. We're seeing them get in and get their mammograms. We're certainly seeing many cancers diagnosed on those mammograms, and a lot of patients are asking questions of themselves, what if this had been diagnosed 6 months earlier? In the case of younger women, I will say it feels to me as if I saw many, many more younger women diagnosed with breast cancer in the pandemic. And I think that was just a function of, as Lauren mentioned, if you're a young woman, you feel a lump in your breast, you notice a change in your body, I think you're more likely to seek care versus an older woman may just think, oh, that's just something, and I'm going to get in my mammogram in a few months. So I think we tended to see a lot of younger patients during the pandemic. But I do think very important. There are lots of you out there. If anybody who's watching today has skipped their mammogram because of the pandemic, absolutely the right decision is to get in and get that. We have early morning hours. We have Saturday hours. You can absolutely get it at a time when it's not busy. They have very good ability to do social distancing in the waiting rooms, and so you should not be afraid of going in to do that. It's incredibly important.
Yeah, it is business as usual when it comes to mammograms.
Absolutely.
Making it safe. A question we get a lot, Dr. O'Day, is about preventative measures. So I want to talk about foods because we hear about soy, processed meats, caffeine being bad for breast health, sugar feeds cancer. Truth? Fiction? Tell us about it.
It's a little bit tricky, as you can imagine. Studying, dietary intake over populations of time over many, many years. Cancer doesn't develop over a few days or weeks or even months. It's something that's happening over, a great deal of time. So it's what our body is exposed to over the long term. In general, I always tell people the best rule of thumb is try to eat food as close to how it's found in nature. So is it really healthy to eat chicken that was raised in, little pins that wasn't allowed to walk around? Does that likely increase stress hormones within that particular animal that may have an ill impact on us? We don't know, but it certainly makes sense to try to, again, eat food as close to how they're found in nature, avoid a lot of processed foods. And in general, the studies, really the literature supports eating 5 or more servings of fruits and vegetables a day, minimizing alcohol intake, maintaining a healthy body weight, exercising 5 hours a week. These are the things that have been statistically shown to lower the risk of breast cancer.
Which really equates to just a really good, solid, healthy lifestyle that we would say almost with anything to rid yourself of any illness. Are there any foods that are just real? What are the superfoods? Just tell us really quick. If you could just say, if you had to eat 3 things in your diet to help preventative cancer measures, what would it be?
Yeah, my daughters are so laughing right now.
Why? Because you probably hound them?
We hound them about they have to eat, a certain amount of these sorts of foods. But think about the foods that are really deeply pigmented, right? So the peppers, the yellow, the orange, the red peppers, the berries, right? Like raspberries, blueberries, blackberries, and all of those foods that are richly pigmented have lots of antioxidants and cancer-fighting medicine. But
do they push back on you?
Sometimes.
Well, you're the boss, right? A couple questions about, Dr. Hawkinson.
Yeah.
John said he went for his booster early in August, then they gave me a whole Moderna shot before it was recommended to do the half shot. tongue in cheek is he extra vaccinated, but is it okay? Tell us more about that. Is it okay that someone got all instead of half?
Yeah, I guess it's unclear exactly why you went in August. That was 6 or 8 weeks before there was a lot of discussion about that. So I'm not really sure if he means his third shot, if he's immunosuppressed. So would certainly like more details on that, why a third dose in August, which was fairly early. But overall, yeah, you're still going to be fine. You made it through. I don't know that you're going to be more protected than with the 50 microgram dose of Moderna, but overall you're going to be very well protected.
Okay, so one of our YouTube viewers has a question for Lauren and Dr. O'Day. Is there any particular support groups for women that you would recommend? Just talking about just preventative measures, getting genetic testing, just support. Anything you can add to that, Lauren?
I found several support groups online, and it really depends on where you're located, but a great one in Kansas City is actually Gilda's Club. I was able to go through 2 online support groups during COVID through Gilda's Club on various topics, fertility preservation, how to eat during chemo, and just other topics about what it's like to go through treatment.
Anything you can add, Dr.
Yes.
O'Day? Where would you send folks?
Well, I totally agree with Lauren, but also just for our younger patients like Lauren, and also for just patients that harbor the BRCA mutation, maybe that haven't been diagnosed with breast cancer, there's an organization called FORCE, there's an organization called the Young Survivors Coalition. These are all organizations that might provide unique insight for patients, or maybe what we call previvors, meaning patients that have or harbor the hereditary mutation that might not have been diagnosed with breast cancer. So lots of good resources out there. Just you want to find a group that feels comfortable to you and that's helpful to you.
There's some good ones out there, I bet. We're going to wrap up. Dr. Hawkinson, quick question from Samantha. She wrote in, when will they allow boosters for teens under 18? My daughter was vaccinated in May. So she will be in November. So will she be in November?
Yeah, I haven't heard any discussion. Again, remember overall, especially if you are under 65 years old and you did get vaccinated early on or as soon as the vaccines were available, you still have very good, excellent protection against hospitalization, severe disease, and death. I haven't really seen a lot of communication or discussion about looking at boosters or additional dosing for those under 18. But hopefully we will be getting some more information. And I would probably not assume any time between before a year. Again, the best evidence we have is that you're still very well protected from that hospitalization, severe disease, and death. And that is also going along with the good thing that we know about this infection is that it is less likely, or you are less risk of having to go to the hospital if you are in those younger age groups as well.
Last question is from Sarah. Any updates on when those 11 to 5 will be able to get vaccinated? She says that her 11-year-old growing impatient to be vaccinated. Yeah. I don't know if that's my kids, but I appreciate
that's good.
The gusto.
I think what we're expecting is really in this early November period is what I saw. So, I think it's imminent. It should be within the next couple weeks. At least getting them one dose, you should have some mild partial protection by the time Thanksgiving rolls around, and then certainly after that, those age groups are going to be eligible for their second dose, and then hopefully keep everybody healthy from that time period on. And we do know also that the more people that are vaccinated in the house, the less infections you have. So overall vaccination is helping as well.
All right, hang tight, kiddo. We're going to get you vaccinated, right? All right, so we're going to get to our final thoughts today. Dr. O'Day, what do you just really want the biggest takeaway for folks to be today with our discussion?
Yeah, I think just to use Lauren as your example, to really just be fearless in your pursuit of your own health and listen to your body, absolutely seek care if you think something's wrong. And really remember, when it comes to breast cancer, when it comes to these hereditary mutations, that knowledge is power. It absolutely gives us the ability to take the best care, design the best plan of preventative care.
All right, Lauren, just first of all, thank you again, like Dr. O'Day said, for sharing your story. Thank you for all you're doing to help advance breast cancer research. And just what do you want? What are your final thoughts today? What do you want us to know?
I guess my first thought would just be very similar to what Dr. O'Day just said. Know your body, do your monthly self-breast exams, and advocate for yourself if you find something that you think is not right. And the other thing I wanted to mention specifically to patients that may have been recently diagnosed is consider participating in a clinical trial. I got better care than I would have gotten with the standard of care. As we were mentioning in today's session, it was about 10% better response rates with the therapy that I received compared to the standard of care. And I'm extremely lucky for that. So participating in a clinical trial can kind of sound scary at the time, but it's likely to give you the best care that's out there.
It benefits you and others in the future, and we do need people to enroll in those trials. Lauren, thank you so much. Dr. Hawkinson, your final thoughts today?
Yeah, hold tight. Hopefully we'll have some information about the children's vaccination coming soon. We know from some early press release in the FDA brief document that there was a effectiveness at 90% or more at just preventing any infection, any disease. So I think that's really good. And we do know that there is a part of the misinformation campaign going out there about not getting vaccinated because the vaccinations cause death. This is absolutely untrue. The safety profile for the vaccines are extremely good. And there's actually a new morbidity mortality weekly report from the CDC looking at 7 different large healthcare associations and organizations in the United States. And that actually showed that those people who did get vaccinated across all ages and sex had a reduced rate of mortality compared to those that were unvaccinated. So that just adds more to this safety profile. And again, there's no truth that these vaccinations really are causing any deaths. So just more information showing how safe and effective these vaccines are.
Thanks, Dr. Hawkinson. And Lauren, just want to let you know, everybody on here, several people just saying how much they appreciate you sharing your story and how brave you are. So thank you, thank you. So before we sign off today, I want to bring in our director here at in our media relations department. This is Jill Chadwick. Together, we wanted to share a bit of good news with you. I'm going to let you do the honors.
Thanks. Hi, everyone. Thank you for letting me come on and say hello. It's been a while. I have a microphone, actually.
Okay.
Go figure. The team would have thought about that.
Okay, right.
I know. But over the weekend, the National Academy of Arts and Television Sciences held its Mid-America Regional Award. So a big shout out to all the local media for all of their winners. And I'm very proud to say that we've got one of these statues, another one, coming along to this team, which I couldn't be more proud of. I wanted to share this award with you especially because we know that the pandemic is just horrible. There are no words to describe how it's impacted all of our lives. But one perhaps bright note is that it has allowed us to meet you. And it has allowed our team to do what we love doing every day, and that's sharing public health and awareness information. And the statue that is coming for us and is on the way because it was a virtual ceremony is a statue for schools and education, short form content, and is for the Sunny Says series. This statue in front of you is from a story we did on liver transplant way back in 2017. Oh, hold it up.
Yep.
There you go. In 2017. It is 2021, so you can imagine how excited we might have gotten during the virtual ceremony.
And the Emmy goes to...
It's pretty crazy.
Calm, cool, and collected. As always.
Yeah. I think what's even more impressive, Jess, is that we did not spill one drop of red wine, although deep in antioxidants, I might point out. It was healthy. It was a healthy drink. Not one on your couch.
No party fouls.
Or your white dog.
I know, right?
Yeah.
We had a good time. And
Yeah.
you got over to my house just in the nick of time, and I would not have wanted to celebrate it any other way than having you right there with me. And
Yeah. I hope my sister forgives me. It was her birthday, and I walked out on it.
Happy
so that I could
birthday.
come.
Sorry. I
Yeah.
hope it was worth it.
Yeah, no, it is. And I couldn't be more proud of the team and of you and, of course, of Sunny. And thank you for allowing me to share this little bit of news with you.
All right, we're going to show Sunny Says, I think, here in just a moment, the one that won. But we want to let you know what's happening tomorrow. Tomorrow we have blogger Dr. Amber Schmidt-Key. She's going to be talking about numbers. She's our numbers gal, super smart when it comes to breaking it all down for us. We're going to take a look at some data out of Georgia and how that relates to us nationally and, of course, right here at home. So everyone have a great day. We're going to see you back here tomorrow at 8 a.m. And here is Sunny, back to school.
Hi friends, I'm Sunny and I'm going in the 2nd grade. School's going to look a little bit weird this year. You might have questions. It might look different for everybody, but here's a sneak peek at what it might look like. Remember, Sunny says, have your mask ready. Make sure it's comfortable. You'll wear it most of the day. First things first.
Good morning, Sunny.
You might have your temperature taken at the door.
You're good to go.
Sunny says, it's okay. It's not scary. You'll probably walk to class alone. Remember to stop by the hand sanitizing station. Follow the signs and keep your distance. Your classroom might look like this. Desks will be spaced apart and you won't get up as much. Instead of hooks or lockers, you might keep your things in a bin close to your desk. You might have more iPad time. It's nice to share, but Sunny says no sharing supplies this year. That can spread germs. Sunny said, most importantly, listen to your teacher. You might have to eat lunch at your desk, but at least you can take off your mask. Sunny says, remember, it won't be like this forever. At recess, you'll see your friends, but still keep your distance. Remember, it's smart to stay 6 feet apart. Sunny says, don't use the drinking fountains. Instead, keep your water bottles full. You'll be asked to wash your hands a lot and use hand sanitizer. Hi, Michael.
Hi, Sunny.
If you take the bus, you'll get on and walk all the way to the back. Pick the first seat available. 1 kid to a seat, if possible. Sunny says, be cool at school, stay safe, and follow the rules.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.